welcome to the webinar. I know we are in unprecedented times and there are a lot of things you could have been doing now, but the very fact you chose to come to this webinar just to learn about healthcare says a lot about all of you, and thank you very much for it. I'll try to make it as productive as possible. Now, what to expect in this webinar? So in this webinar, I'm going to go over a brief overview of the healthcare industry, because most of us have some idea, but the picture is much bigger. So I would like to take you over to the different aspects, and then we'll also explore what are the career opportunities as we go along. Now, before we dive in, if you don't mind, I'll just take a few minutes to share about my background. So my name is Ajay Aiyar, and by education, I'm an electronics engineer. I studied in India only, and I was one of the lucky few who got into the computer industry in the early 80s. And within a few years, I was in the US, and I spent the next 25 years in the US working on the high-tech side. So I did a lot of electronic design. I worked on some defense projects for the US government. And then I also had my own startup, which was a venture capital funded startup we had. And we took it from an idea stage, built a company, sold it. And then later on, about 14 years ago, I decided to switch my career to healthcare. This was something of my childhood dream that I should be in healthcare. For one reason, of course, computers also I loved, so I got what I wanted. But then this was something I said I decided a long time ago, and maybe I should really do it, before I get too old. And I switched my career to healthcare. Amazing place to work, and I'll share more details as we go along. So we'll start with the ecosystem itself first. So if we look at the healthcare ecosystem, now healthcare itself is very big. And when I ask typically, what is healthcare, your idea, can you share what comes to your mind when we talk about healthcare from your experience? When you hear the word healthcare, what comes to your mind? Thanks, Sandhya. Yeah, it's hospital. Okay. Yeah. Yes. Human lifesaver. Very good, Jaydev. Yes. Isha, doctors, medicines. Of course. Yeah. Rohit, doctors. Excellent. Serving the people. Yes. Very good, Ayush. We'll cover that point also as we go along. Doctors, medicines. Excellent. Yeah. So that is the very first image that comes, because doctors are the first point of contact for most of the, yes, Ashwin, staying fit, insurance, okay, doctors, hospital, medicine, pharma, yes, okay. So they are the first point of contact, but healthcare is much bigger than that, and we'll go over. So let's briefly look at what is the ecosystem. See, we all know hospitals as the primary thing where we come in touch with it, but there is a bigger picture also, which is also medical tourism is growing. In India, it's growing, but if you go to some other countries like especially Thailand and Singapore, medical tourism is a big business. We also have health insurance. It's a huge business. May not be in India. Health insurance is maybe only 20% of the people have it. But typically, if you look in many of the Western countries, practically over 90% of the population is insured. Another growing area very much related to healthcare is telemedicine. A lot of work is going on in that area. Another thing that happens in hospitals and clinics are clinical trials. Of course, as a patient, you may not know about it, but all these clinical trials for all the new drugs usually happens in hospitals or clinics. Another big area is devices. Okay, so when we talk about devices, we are talking about, primarily I'm referring to many of the things that go within your body. Okay, or like it could be a pacemaker, it could be a stent. Okay, so there are multiple things that happen. Huge industry, devices is a huge industry. Okay, and then we also have a very big equipment industry. What I mean by equipment, when you think about X-rays, MRIs, and you name it, right? Operation table or operation tables. There's a whole lot of equipment that is used within an hospital, which is very critical for healthcare. All this forms the healthcare ecosystem. And there are opportunities in every single area of this ecosystem. So I'll move on to the role here. So this is a very important role that hospitals play in our lives. Now, interestingly, the whole of human civilization is centered upon the human being. And in that center, the hospitals come in the center because they are key to our healthcare, our living healthy and living long and living well. So pretty much it's cradle to grave, that you will heard that term. But I'll go a little further. The reality is it is before the cradle, right from the conception, right from the maternity, which is before birth. And all the people say it is grave, yes, but even after death, or there is one more step that can happen in many cases, which is post-mortem. So healthcare is one area where it's involved in our lives before we are born to definitely till our death, and most of us, there's a good chance, may end up in a hospital. So we have a 10, 90 and a 90, 10 rule. It's a rule of thumb. So basically what it says is you will spend 10% of your money in the first 90% of your life and the remaining 90% of your money in the remaining 10% of your life. So in the last few years of your life, generally it is only 2-3 years, you will spend more money than you have spent in your entire life. So you can imagine 60, 70, 80 years, in the last few years you're going to spend that money. Because generally as soon as hospitalization happens, the meter runs really, really fast. It's very expensive, and depending on the complications, the expenses can really run very high, and also what is needed to keep an individual alive and make them well. Now, this is one industry where you can truly find the attitude of service at every level. Yes, I've heard many people say it has become a pure business and all. Notwithstanding that fact, this is a place where truly you will find every level you will find, from the person who's cleaning the rooms and setting up the beds and, making sure a new patient can be admitted, to all the way to the doctors and surgeons and the hospital staff and nurses. You will find they really look at it as a service. Because come to think about it, especially if you are in the clinical care side, like a doctor or a nurse, okay, where you are dealing with the blood and, a lot of these bodily fluids and patients who are very sick. It is a tough job for them to take care of it, right? Many times you will find even your own family members wouldn't want to touch you because you are in such a bad shape. But these are the people who will go and make sure you're taken care of and that, you are served so you can get better and go back home. So this attitude of service is what makes this industry a great place to work. Okay, and it goes really beyond money. I have worked most of my life on the back end, on the healthcare IT side. And even there, many times we'll get a lot of good comments from the doctors and all whom we'll support, which is basically my team used to support the doctors and nurses, the clinical staff in the US hospitals. And we will get very good comments. And although we are still not in the front line, a lot of people will thank us because we are making sure behind the scenes, everything is working. So typically when you go to a hospital and you see a doctor or a nurse working, what happens is typically there will be 4 to 8 people working behind the scenes to make sure that you get well soon. And I want you to visualize, let's say when you walk into a hospital, right? As you walk in, you will see that you have the reception. Somebody's there at the reception to greet you and then direct you to do whatever paperwork is needed for the insurance. Then there is billing. Then somebody takes you, make sure your admission happens. Somebody makes sure your food is taken care of, which is specialized diet. In many cases, that would somebody make sure that you keep getting the medicines all the time, at the right time, the right medication. Somebody takes care of your, takes the blood samples, taking your vitals, what you call in the industry, like your blood pressure and temperature and heart rate. So all these things are happening before many of these things happen even before you actually see the doctor. There's a huge support staff that makes this healthcare possible. And many times they almost seem like invisible, but if you start paying attention, you realize how many people are touching you as a patient as you get to the service where the doctor comes and starts looking at you. And once the doctor gives whatever the prescription or, what are the regimen that you need to follow, then the nurses and all take over. So if anybody's from a career point of view, my suggestion is this is one thing you need to have very important, that attitude that, hey, I'm really helping people. You really make a difference whether somebody says it or not. And once you work in that environment, it becomes very, very obvious. It becomes so obvious that you are touching people's life. So that's one thing that makes it a great industry. So when we talk about the future, right? So what is the impact or what the future looks like? Now, I'll give you a very interesting data. In India, the healthcare spending is only about like 3.6, 3.7% of the GDP. That's it. It's a very small percentage. And the government spending, which in the last 5 years has doubled because of a lot of the effort that Prime Minister Modi is doing to help the poor and all, government spending has gone up from 1,000 rupees per person to 2,000 rupees within the last 5 years. And I expect this number to keep going up. Now let's look at the industry in the US. The US, the healthcare spending is 3.6 trillion, that is with a T, which is more than the GDP of India. And their average spend per person in the country is over $11,000 per year. So you can see the gap between where India is and where US is. And many other countries, developed nations come, UK may be around $10,000. And even if you come down to all the way to South Africa, they are also way higher than us. China is about 5,000 rupees per person. So the growth opportunity is huge. As we develop economically, as people become more educated, the demand for healthcare rises. So you can see the gap from, let's say, where we had to go from a few thousand rupees to $10,000-$11,000. You can see the range of how much it could be done. So this is just to give a comparison, so you can pretty much extrapolate in your mind, okay, what is the scope? Just imagine 1.3, our population is growing, our economy is growing, and people are demanding better service. Also, the government is actually giving a lot of this, Ayushman Bharat and all, many of these schemes, like for a few crores people, like 5 crores or so who are being covered. You can imagine the demand for all the healthcare services. Yes, Sandeep. Sandeep has a question. It's about opportunities available for well-experienced IT management professionals can look into hospital medical industry. It's a great opportunity, Sandeep, because I'll tell you, I came from the IT space, healthcare IT, because there are a lot of specialized software that we use, both from the clinical side. So when I use the word clinical, that is doctors, nurses, pharmacists, and lab technicians, they all use, the clinical folks. And then there is a lot that the administration uses, and then there is another piece that the billing folks use. So huge opportunity. I'm just talking from the specialized area. But every hospital within itself also has a lot of IT, not only supporting the IT, like we're talking computers and tablets and all those pieces, but also a lot of equipment, medical equipment that gets supported. Now that is not directly IT, but that's also a team generally may come under an IT head to manage all the management of all the other equipment that the hospital does that. Ashwini, I'm not clear on your question, but why is low where in population? Yeah, so Ashwini, that is because just our economy, our ability to afford, that's all. But if you look at it within the last 5 years, more and more money is going into healthcare. So this will only grow. This will grow phenomenally in India because as economy improves, as living standards improves, people aspirations also go up, and then they start demanding these services. So it's no longer that, I'm hopeless. People say, hey, we need this. And one thing that you can observe in real life is, you go to any hospital, you will be surprised. Every hospital is crowded. Every hospital, especially in the cities, I'm yet to see a hospital which is not crowded. Okay, so that itself tells you that a lot of people come to cities because in the villages or surrounding areas, the quality of the healthcare is not very good. But eventually that will change. Eventually that will change as the market develops and it becomes viable. And I will cover that point on the viability, as we go along. So let's look at some of the healthcare aspects. So if you look at these are the statistics from the government of India. Our total hospital spend, right? And it was about $61.8 billion in 2017, whereas it's going to grow to $132 billion in the next 5 years. So which is a compounded annual growth of about 16 to 17%. It is, so that's a huge growth beyond any normal growth, right? So this industry is really growing. Medical tourism, India is slowly becoming a destination for medical tourism, not from the Western countries. People are not coming from US or Europe to India, but from a lot of nearby countries. When you look at it, all like Kazakhstan, Afghanistan, Iran, Middle East, okay, Bangladesh, and some of these areas, many people are coming. Many African countries, they come to India because India still offers affordable and very good quality care compared to what all is available in those countries. And then diagnostics is also a huge area. So what do we mean by diagnostics? Most common diagnostic is anytime you go to visit a doctor, you go to the lab, right? Doing the blood test. So that is the lab. The other diagnostics that is also done is all the radiology part, right? You may take an X-ray, you can take an MRI. They are all part of the diagnostics industry. And the other part is primary care, which is the first level of care that we go to, right? The first level of doctors that we go to, which is typically the clinics. That itself is already a $13 billion industry. So this is really growing. And let's also look at what are the growth drivers, right? Okay, this is where it looks today. What will make it even grow further? So let's look at those aspects. The biggest one is life expectancy. We are expecting Indians to have an average life expectancy of about 70 years by 2022. This is a huge improvement. So if you look at statistics, right, I was just checking some numbers. Around independence, 1947, our life expectancy was only like 33 or 34 years. And in the early 30s, late 20s and early 30s, I'm talking close to 100 years ago, the average Indian only used to live 26 years. You may be shocked to know this. 26 years. Basically, many of them were dying as youth itself. They were not even getting to 40. So now from 33, 34, we are reaching 70 years in age. Huge improvement in our life expectancy. And these numbers also hide one fact, which is not very visible. This is the all India average. But if you are living in a city, if you are educated, if you are middle class, okay, with with better hygiene and all that stuff, typically you will live to 80, 85. And you can see that in many middle class families, you have senior citizens living up to 80, 85, 90 years old. But this is the overall India numbers. So what that means is that more and more healthcare will be needed. As people live long, more and more healthcare will be needed. Then, of course, with the way technology is growing, telemedicine will becoming more and more popular. Now, a lot of effort has been gone in telemedicine in the last 20 years. But just like if you think of internet, how predominant it has become, even in a country like India in the last few years, this tells you how much more can happen in telemedicine. And in a country, something like India, where we are geographically spread out, this will be a boon to the people. Better technology, better reach, and another thing is that many of the medical equipment are coming down in prices. Many of them are even being designed in India now, which is bringing the cost down. Third area is the coverage. So in insurance, when you look at it, we have only like about 20% coverage. When you compare to any Western countries like UK and US, you'll find about over 90% coverage. Or US maybe 80%, UK is even more because of the socialized medicine there. So huge area on the side of health insurance growth. Huge opportunities. And it's very obvious if you see the number of ads that you see on TV on health insurance. It's amazing. That should give you that all these players are fighting it out to get a bigger piece of the pie, because this is a massive piece. And earlier on, I briefly shared with you, right, the gap between what we spend and what is spent in, let's say, a country like US, that's long ways for us to go there. Which is, in one way, you can look at it as a gap, or you can look at it as a huge opportunity going forward that will last 40, 50, 100 means. As long as humans are there, people will keep falling sick, right? And the other thing is, as development is happening, income is going up and more urbanization is happening, more and more people are demanding better healthcare. So market is demanding, the demographics is making it happen. So everything is converging in the right area. And the medical infrastructure. So what I mean is, this is primarily, you are talking about all the hospitals and all are expected to spend in new hospitals and new equipment and new setup, over $200 billion in the next 4 years is expected there. Huge investments are coming up in that area. So so two questions. So Rajendra, to your question, there is a little bit of depreciation, no doubt, but 2014 to 19, we had lot less depreciation in terms of the devaluation of the rupee. But there are two things. We are only looking at government spending, but government spending is a much smaller portion than the private spending that happens. So when most of us, I believe, in this group, we go out, we are not getting any government insurance. We are going to either a private clinic or a private hospital. So the private is a huge part in India at this point. So that is one. So yes, the services are improving, no doubt. See, the another metric of looking at our services improving is, you can also look at that life expectancy is improving. And one more factor which I see will even help give a little bump in the life expectancy in the next few years is all the Swachhata Abhiyan, right, that the Prime Minister started. See, a lot of diseases come because when you don't have good hygiene and cleanliness, the spread of diseases is much more. Now, it may be a little difficult to quantify it, but we all know that when things are clean, diseases spread less. So I expect maybe a year or two can go up in the life expectancy, because the overall cleanliness in the country has definitely gone up. It's not perfect. We are nowhere close to, anywhere like US or Switzerland. But compared to what we were 5-6 years ago, we definitely are making good progress in that area. So that will also help in life expectancy in terms of, people living longer because they don't fall sick and, and the mortality, it doesn't get impacted there. And there was one more comment. Yes, Ashwini. See, the growth is really dependent on the economy. See, if people can't afford a service, then that is where the biggest challenge is. So as our the living standards go up, more and more people will start using the services. So that's why you see, if you ever compare the growth in cities, so if you look at Bangalore, how many hospitals are there? But all you need to go is just 20, 30 or 40 kilometers. You go outskirts of Bangalore, suddenly it thins out because the demand is not there and the affordability is not there. So let's look at the one interesting part, which I call the players. Who are all the players in this game, who have an interest in this healthcare system? See, India's other issues are, the poor quality of food and other things also gets factored in, right? So 70 is a good year, but in middle class, 80 is becoming very common. Just check around all your friends and family. You will see a lot of people are living 80, 85, 90. So one section definitely. Overall population, I still doubt it because of the big gap we have, the economic gap that we have. So, but we will get there. I'm telling you, we'll get there faster. This will be a bigger problem going forward because our life expectancy will go faster and will become more and more with all the new advances that are happening in medicine and surgeries. I mean, you name it. It's unbelievable how much advances are happening in the field of medicine. Yeah, Shashikant, yes, your question is correct. AI is very much useful, and I'll tell you, coming from the healthcare IT side, and this is one of the major things that the US government did over 20 years ago or 18 years ago, when they made it mandatory for all clinics and hospitals to have an electronic medical record system to capture all the patient data. All the billing became digital, fully electronic, and the idea behind that was to collect all this patient data. Not only where the patients are from the healthcare, from the doctor's perspective, but also what medicines are being prescribed. So the amount of data that has been collected is just beyond belief. Okay. And the idea is to do a lot of analytical research on this data. So yes, AI will be huge. So analytics is very huge in the healthcare side, and it's growing. It will keep on growing as we capture more and more data and we start finding a lot of these correlations between the various diseases and causes. And I'll give you a very classic example. If you look at, I'm just thinking, what is that virus that came out of Africa? I'm not getting the name. How are they able to detect it so quickly that it is originating in Africa, right?
Ebola?
And who are the patients? I'm sorry?
Are you talking about Ebola?
Ebola, thanks.
Yeah.
Yes. So how did we see? This is where the power of analytics comes in, and our ability to capture the data in electronic medical systems, because once they found the first few patients, they were very quickly able to trace it, where these people came from, where the next patients are falling sick, and through analytics they were immediately able to build a profile and were able to stop it very quickly in the US. So that is the beauty of analytics, So yeah, thanks Sumit for Ebola. Yes, okay. So the Sumit scope for EHR in India, maybe can I take it up in the end? It's a big issue. I know a little bit about this industry. Scope is good, but I'll tell you the challenge in India is, in India we typically have a factory model. Okay, because the reason I came to India from US was to implement one of the largest EHR systems in India. Okay, that was the only reason I came here to do. And one thing we found out was, because EHR systems take too much time for data entry, and this is true even in US. So in US, the only reason the doctors accepted it because the government made it a law. Simple. Either you implement the system or there is a penalty. So it didn't happen even in US because doctor decided, hey, it is good for better care I can give. That was not the reason at all. It was forced on them because there were visionaries in the government and all, right, who realized what great stuff that can be done if all this data is collected. So in India, what happens is, it is a factory model. So if it takes a doctor, some time to enter, many of them think, hey, I could have seen another patient and generated more revenue. So that is the challenge, but I believe more and more hospitals are going into it, at least the progressive ones, because they see the quality of care is significantly improved, and they are able to do analytics and improve their overall service. So from an inpatient point of view or acute care, yes, it will go. Ambulatory, I have my doubts, because ambulatory doctor sees a patient for 3 or 4 minutes in India. And if it takes a doctor 10 minutes to enter the patient history, of that encounter, it's not going to work. So inpatient, yes, good scope. Outpatient, I still have my own doubts. All right. So did you get the answer to my question, Sumit? So we already did the go drivers. Let's look at the players now. So we have basically 4 players in this entire game. One is, of course, the patients, really what we call the customers. Then we have the staff that actually delivers the care. Then there's one very important role which most people don't know, are regulators. Because we are dealing with life and death situation, both healthcare devices, pharmacy or pharmaceuticals also, you see a lot of regulations are there. Okay, so regulators play a very important role just to make sure that safety is there, all proper procedures are followed. So they play and then you also have investors. Okay, sometimes we forget about investors, but let's look at the patients. So here are the patient's expectations. They want the best care at the lowest fees and must have, I put greater access. Ideally, they want universal access. Hey, wherever I go, I must have health care. If I fall sick, there must be a hospital close by. It should be available 24/7 where I can get a care. These are the patient's expectations. Okay. Now, of course, it's our life. And of course, when it comes to my life, of course, I want that also. And I'm pretty sure it's true for each one of us, right? Because for us, our life or our loved one's life is the most valuable thing. So we'll say this is what we want. Now, let's look at the staff, right? Now, staff really, in a broad classification, you can divide into two groups. One is the clinical, which is the front end that you usually see when they go in as patients, the one who actually provide the care. But there's a huge amount of non-clinical staff that works there and supports the clinical staff. This could be, if you can look at all the kitchens that run, all the beds and the rooms that are maintained, all the purchases that are made, all the billing that happens. Okay, all the cleanliness that is kept and all the people who work make sure all the regulatory compliance is going on. So there's a huge amount of staff that is there, which is all non-clinical. Huge opportunities there also. Then of course regulators are there to make sure that all compliance and all safety standards are followed. Investors come because there we see some big hospitals and Medicity and Max and of course Apollo, all these. One thing that which is inherently in conflict with patients' expectations. See, healthcare is very capital intensive. This is what a common man may not realize. Healthcare is very capital intensive. To set up a hospital, all the equipment, okay, is huge amount of money. But there is another challenge that is very typical to healthcare. You need highly qualified staff. So you cannot produce doctors in a factory. If you just go through the medical school and try to get a doctor to work a few years, the amount of investment, both in terms of money and the individual's investment to learn and become good in his area of specialty, in his or her area of specialty is huge. So, and since this whole industry depends on highly skilled labor, okay, it really drives the cost up. Nurses, there is no such thing as a generic nurse. Yeah, some of them are generic. A lot of them are specialized if you think about it. So if you go to a operating room, those nurses are very specialized in what they do. And generally in US and all, at least I know the US salaries, very high salaries because these are all specialized. And in US definitely they also insist on a lot of certifications, continuous education. So all these things make healthcare very expensive. So not only the overall capital intensive stuff, but also the need for having specialized people. That's what makes it very hard. That's why when people say, why can't we have so many hospitals? Because you cannot produce doctors fast enough. And medical education is not any easy, right? It's a demanding education. You don't want people with certificate. You want people who truly have the knowledge to provide the good care. So this is the challenge, that even when you have the money, you may not have the talent to support those kind of investments. Yes, I know to a degree, it's a little bit of a monologue. Any questions so far? Yes, Manish, that is true. The US healthcare is very expensive for some of the reasons we already discussed. And another reason US healthcare is expensive is the amount of lawsuits. That's an entire legal industry that thrives. Okay, so the insurance for a doctor, because I have a few doctors in my family there in the US, is beyond belief. You can't even believe how much is the health insurance. I'll tell you, I have a son, he's 25 years old. His health insurance, now 25, you will think, man, should be the minimum, right? He's a kid who exercises regularly, maintains his diet, like most kids, right? They're a lot more health conscious these days. His monthly premium, and he just goes to the doctor once a year for his annual checkup. And that's because my wife and I insist he should go. All right. He's paying over $500 a month at age 25. So the reason is, of course, you get a great care. Then medical education is extremely expensive. So they are not producing too many doctors. And even doctors who come from abroad, many of them do not, pass their certification exams because they are fairly demanding. That's one of the reasons healthcare is very good. And the other point I mentioned is there are a lot of lawyers who really want to thrive on a mistake a doctor or a hospital may make, and you soon have a multi-million-dollar lawsuit there. And when lawsuits happens, the insurance on the clinical staff goes up or on the hospital goes up. So it's like one of those vicious cycles. The more you sue, the more expensive the insurance gets. The more expensive the insurance gets, the more you have to charge the patients. So it just keeps going up and up. That's why the US per capita spending is over 11,000. Means that healthcare spending is 3.6 trillion, which is more than the GDP of India with 1/4 the population. So you can see the challenge there. So how do you account for a scheme for healthcare? That is very good, Shiv Shankar, because what that is doing is it's bringing the one segment, I believe about like 5 crore people from what I understand are being covered. These people who probably ignore taking good care of their health or live with it, okay, they are bringing this lower segment into the hospitals now. So eventually the demand will go up. See, if the lowest level gets awareness that, hey, my health is important and maybe I'm covered because the government wants me to go and take good care of my health, I think that awareness will create a lot of new opportunities. So you need to create a lot of good hospitals or, delivery centers. Whether it could be primary care or secondary or tertiary, all of those have to be created because awareness is going up. So from that point of view, I see it as a great move because the first level to develop any industry is the general population must have an awareness that, hey, that something can be done about it, and it's not about fate or it's not, God's being angry, anything like that. That something can be done about it. Vinay, your question, are there any untrodden areas in India that are new in healthcare industry? See, in India, the issue is typically most of the rural areas are untrodden, right? Because even today, when somebody is in a small town, they need healthcare. Let's say if they want to get some surgery done or even get a second opinion, they usually have to come to the cities. And again, this is all getting down. We talked about the players, right? The economics of healthcare is such that you must have enough population to sustain a hospital, okay, or a small center where you can have some doctor who can do the primary care, and then in a hub and spoke model, route the subsequent patients to better hospitals in the city or in that district, whatever. So this model is still evolving. Definitely, the scope is huge. You have to take care of 1.3 billion people. So the only challenge is the viability. When you go outside, how will you make sure it's viable, and how do you make sure that doctors and all the clinical staff, the guys who generally get paid very well because they bring a high value skill set, how do you compensate them in those areas? Because a lot of doctors don't want to go to small areas, okay? At least in volume. There are many who go and want to work, but I'm making a very general comment here. Preventative, Vinay, yes, your question is very good. Preventative is the only way to reduce the healthcare cost and to reduce one's burden on healthcare. Especially with, I know there's an earlier comment on lifestyle diseases. So preventative and also making sure you have the right lifestyle is the only way. Because see, what is happening, I'll tell you in the US also, it's reached a point where literally the government is feeling helpless on what they can do because people want to smoke, their health is in a bad shape, then they become older and then a lot of money gets spent on them, but things could have been done better had they taken better care of their health. So people have to play their part. It cannot be, somehow I'll always go and fix the problem. You cannot fix all the problems can't be fixed. Yeah, Isha, when you say biotechnologist, you need to give me a little bit more detail. Maybe I'll take it up later, okay? So, Tejas, what do you mean by a mechanical background? Are you talking about a mechanical engineering? So, I'm assuming I'll give you an answer as a mechanical engineer. I'm assuming that's what you mean. Yes, see, there are opportunities, especially if you go and work with many of the equipment manufacturers, because every equipment manufacturer have chassis and enclosures and a lot of things that go from a mechanical engineering point of view. Even structurally making product, let's say there's a lot of mechanical engineering goes into when you're making an X-ray machine or an MRI, or even the smaller machines that we're making, right, ECG and all. So definitely there is a role in that area. I don't see any direct role as a clinical, because clinical is a different field, requires completely different level of training. So that is one area definitely a mechanical engineer can work. Are there any new sectors in healthcare? Yes, there are new sectors, but they are very evolving, and I think they may still be maybe 5 to 10 years away There's one area which is called personalized medicine that they're talking about. See, right now, every medicine that is coming out, it's like, for lack of a better term, it's like for a generic population, right? So let's take an example of aspirin. Simple example I'm taking. Everybody takes the same dosage. The only variation is in the dosage. Okay, and maybe whether it is in a gel form or a tablet form. But that is one type of medicine that the doctor can prescribe. But a lot of research is going on where people are saying, hey, can I make a change in a person's DNA or a very, very specific solution that only works for that individual, literally like a customized medicine. There's a lot of research is happening in that area. We are still way far off in India, but yeah, maybe super rich can afford that. But then the question, if somebody is super rich, why would they want treatment in India, right? We pretty much know they rather go to US and get the treatment. I see a lot of scope in telemedicine, a lot of scope in having a lot of equipment at home where you can do remote diagnostics, right? So since I have senior citizens in my home, okay, like I'll give you a simple example, which is some of you may know, testing your blood sugar, right? Very simple way of knowing. You can track yourself. If something looks abnormal, you can go and see your doctor. Measuring your blood pressure. So some of these things are there that can be done remotely nowadays. So people don't have to go to a clinic. And I see a lot of improvement, especially with all the new technology, with practically every home being internet ready now. So I definitely see huge scope. And this could be maybe a good model going for remote areas where you can have just maybe a few clinicians, may not be very experienced, who know all the basics and who can help coordinate with maybe a center in the city and do all the basic stuff, for early diagnosis. So let's talk about uniqueness of this industry. We pretty much know this is one of those, as they say, the store where it needs to work 24/7. I'm talking about hospitals, not the primary care physicians. Okay, and it's everybody who goes. Even it's a life and death matter here. So even something that looks may not be very threatening. There's a very interesting statistic, and this is fairly old, maybe 8-10 years old, that in US they found out, and of course they can find out because they do a lot of data collection in the US, that over 100,000, over 1 lakh deaths are happening because of hospital-related mistakes. And or the person catches a disease in the hospital because they came to the hospital. So this is always alive. So anytime you go, it's a life and death, and like it's also unpredictable. Okay, why is unpredictable? Let's look at the COVID, right? Did anybody expect? Did any hospital, was it ready? No, it's like it just happened. Okay, and you can see, of course, our response has been great. The people cooperated, our doctors, nurses, and everybody did an amazing job. But it's unpredictable. Suddenly, government wants 30%, 40%, 70% of the hospital beds to be reserved for COVID people because we are not able to predict how many patients will come, how many have to be quarantined. So this unpredictable nature makes it very hard on especially the staff, and I already mentioned on the high operational cost, right? We already covered this. Specialized manpower, lot of capital equipment, and regulations also cost a lot of money. Anytime you have regulations, that industry, that's a huge cost. That's why one of the reasons pharma is very expensive is because of regulations, which is good. It saves our lives. So we can't complain about it, but there is a price for that. So this we briefly touched when I started the intro, right? It really starts from maternity, goes to pediatrics or for adult care. You also have emergencies. Then you have seniors, which is basically geriatrics and postmortem. Okay. So, healthcare is there. I'm assuming most of us were born in an hospital. So our first encounter with any profession as soon as we are born is healthcare. Okay. And for most of us, most likely that end will also be somewhere with an healthcare professional. So this profession touches life, man. Along our entire life cycle, healthcare will be there, impacting our lives. Now I'll go on some little technical part. Basically, when we talk about healthcare, we really talked about 3 types of care. One is the primary care, then secondary and tertiary, which is like 1, 2, 3, really. So primary is pretty much you all know. Okay. Really, primary by nature is ambulatory. Ambulatory means something that you can walk in. So this is for all the day-to-day stuff, right? You get cold, cough, you got a little fever. Okay, you do that. Now what has happened because of advances, day surgeries we used to take 1 day, 2 days and 3 days of hospitalization. Many of them have moved into a 1-day surgery. So today you can go get a cataract done. You go in the morning, in a few hours it is done. and many other things you can do like that, right? Then, so who is the first? So that is typically what we call ambulatory, which is also known as primary care. See, the first point of contact, of course, is we call it a general practitioner or a family physician. The other person you will meet is also a nurse practitioner, and generally you see a lot of nurse practitioners either in the pediatrics area or in the gerontology, which is for senior citizens. That's where you will see a lot of nurses who will be taking care of them. Doctors come do the checkups and all, but the continuing care happens with the nurse. And then, of course, this is ambulatory one. It's pretty much on an as-needed basis. You have some issue, fever, sneezing, getting temperature, stomach hurting. You just walk in. That's it. The other thing that is done. See, originally, historically, it used to be done by secondary, but it has moved into the primary care now. Is many of the chronic care, which is if you have diabetes, now you just see a ambulatory doctor or a primary physician who, of course, they specialize in these areas. But so it has moved from secondary into primary. So it's one of those things because of advances, hypertension, angina, thyroid, arthritis. All these have also moved into primary healthcare now. Secondary is the one where a primary physician suggests you go and take a look. So it could be somebody can say, hey, listen, okay, you have a heart issue. Let me recommend you or send you for a consultation with a cardiologist, and you can go there. Somebody can send you with an endocrinologist if you have a diabetes and take care of that. So that is secondary care. So the first level can screen, realize, hey, this person needs specialized care. Tertiary is where it is hospitalization first, tertiary, and second is where surgeries need to happen. So if you need to have an angioplasty done, or any kind of surgery done, then you are gone into a tertiary care. Okay, it could be cancer. Okay, some surgeries, cancer treatments. These all go into, because of their very specialized nature. Okay, cardiac surgery. So these are all in the tertiary care. So these are the three types of care. Now this type requires all clinical education. Either you can be a doctor, and within a doctor, of course, you have your MBBS. Then you become MD by specializing in certain areas. Then you can be a nurse. And again, you can do, of course, your general nursing you can do, and then you specialize in certain areas. So if it is surgery and all, if that's the area, you can specialize. So that you go to a nursing school and do your education. And then if you're in the lab, of course, again, you get trained as a lab technician, and you can specialize there also in certain areas, because there are tens and thousands of tests that can be done. So what we typically see it's a small subset that is very, very common. But there are many specialized tests that happen, and there are many specialized labs. So if you go to the hospital only do tests which are typically what we call the Pareto principle, right? The most commonly used test is what a hospital does. But if a specialized test is needed, they will send it to a specialized lab, and there may be only a few within the city. That's it, where they will do a lot of these not so common tests which are needed. Same thing with, you can go to a pharmacy college and become a pharmacist. So pharmacists, you can work, of course, in the pharmacy, but that same degree can also take you to the pharmacy industry also. Okay, so ancillary service, we already spoke about diagnostics, which is lab, this thing. There's another big area that is becoming popular, at least in US it's growing, genetic testing. So that's one area. Therapeutic this is huge area that is growing. US, it's a huge area in US. India also, it is growing very well as people age. One is rehab. Rehab could be like, even if you're a sports person, you get hurt, there may be rehab. People, coming out of surgeries, any of those things where it is a long-term care that is needed. Physical therapeutic is like being a physical therapist and all. It could be for athletes, it could be for senior citizens, it could be for people who had come out of surgery and maybe they need to do exercise their leg or hand, whatever. So that's another very growing area. Okay, occupational is work-related injuries. So you will see bigger companies will have some nurse or a doctor stationed at least during the key business hours. So occupational is also a growing area. Then of course they are related, which is therapeutic, is you have massage, speech therapy, chiropractor. All these are areas which are needed. Okay, and another area that you will see that is again growing huge is custodial hospice. This is pretty much like an end of life, where the doctors pretty much have determined that this person will not live very long. It could be 3 months, 6 months, something like that. And so they will put them in. This is really an end of life. Somebody's just taking care of them. making sure whatever best can be done. But they know that, it's about time for this individual. Then, of course, you have long-term care, somebody who's not very well, sick, needs continuous care. And then you also have a lot of nursing facilities. And urgent care is something I have not seen too much, or maybe we don't have a distinction. In US, urgent cares are very popular. Urgent cares are somewhere sandwiched between your ambulatory, a general physician, and an emergency. So let's say a child cuts his finger. It's not an emergency because emergency is very expensive, but it still requires an immediate treatment. Okay, but it's not something you can wait till next day. So urgent care is sandwiched in between there, where you can just go, you fall down, you get hurt, maybe you're bleeding or whatever. It's not severe enough for emergency, but it is not something you can wait. So then you go to urgent care. And then if urgent care determines, hey, things are really bad with whatever the initial diagnosis they do, then you can go to emergency. So many insurances will cover urgent care before you can go to emergency. So a lot of what I spoke up till now has been more on the clinical side, the hospital side, right? Now there is a huge component, massive component, which is the billing side. In our technical parlance, we call it payer. So the clinical side, we call it provider because they are providing the care. Payer is where they are the guys who actually pay the hospital. So it could be insurance. This is a huge industry, claims filing. So there are two kinds of billing. One is, of course, the cash billing that happens within the hospital, all right, which is very big in India. But again, its insurance is growing. And then what happens is then you have an insurance company where you buy your insurance either on your own or through your employer. And this is where you hear all these ads about cashless claims and all. So the idea behind this is that, hey, as long as you have insurance, you don't need cash to, get your treatment done in this hospital. So these are the companies where, so third party claims is when a hospital files a bill, it does not send directly to the insurance company. So let's say you have, I believe the one big player is Star Insurance, right? Or Apollo. So let's say you have their insurance card. So when you first get admitted, they get pre-approvals, what is called. So the doctor will say, hey, these are all the things I need to do on this particular patient. They reach out to the insurance company and get a pre-approval, saying, okay, the insurance company will validate, saying, hey, this person has this coverage. What are the limits? What can be done? And so that is more on the doctor and the insurance company side. So they make sure that the payment is going to happen. And there could be some deductible also, where you say, hey, the patient pays 10% or 20%, depending on the insurance plan. When the billing happens, it is the third party where the bills go to. All the bills go to, and they are the ones who will validate and make sure that the payment is all being done in compliance with the policy and in compliance with whatever are the limits that the insurance company has set. So these people play a huge role, the third party claims. So if you look at the healthcare, clinical care, see, I was on the clinical care. So I had built a fairly large team within India here in Bangalore and Noida. A lot of primary clinical care work is not coming to us from an EMR support point of view because a lot of issues, but primarily these are very high paying jobs in the US. So when we are competing and taking those jobs, that's naturally a serious backlash which we see. And also to train people, it takes a while and all. And also it's a question of liability because that is also scares people in offshoring that work, but it is growing. But billing, India is big in this game because billing, patient risk is not there, right? And there are a lot of good companies where a lot of billing happens in this area. Huge opportunities. And again, you also have this onshore, offshore issues. But this is one great area where non-clinical people can go and work. And people get trained there, how to process the bills. A lot of automation happening in this area. Huge amounts of automation that is happening where the machine can read and decipher what is allowed, not allowed, and it can process the claims. So human element is going down here and a lot of automation is coming in. The next area which we see a lot but generally gets overlooked for one thing is the administrative part. So in administrative, I have lumped up every operational aspect which is neither clinical nor billing. So you have a medical director and his team that looks after the entire hospital. They basically run the hospital. There's an entire section that manages all the rooms. When a patient is checking in, when they are checking out, the rooms are cleaned out and even the cleaning staff is very highly trained because they're dealing in blood. There could have been death in that room, various bodily fluids. So that cleanliness It's not like your average person you see. They are trained very well to make sure that the hygiene is maintained. Another big area in a hospital, again, is very behind the scene. Food service is big. Food, one is of course the canteens for the entire staff to dine, but there is also a big section that, depending on the patient, most of the patients may have specialized dietary requirements. So special diet is prepared for them. Then of course there's a dietitian who prescribes the diet, the timing, quantity, and all that stuff. And the food service within the hospital is what makes sure that that is all taken care of. Huge staff that works practically invisible, but very making sure every single thing in the main facility is working. It could be as simple as the light bulb not working to making sure the general cleanliness is there, rooms are clean, restrooms are clean, and overall everything is working within that place. Again, another huge play is IT. Since every hospital nowadays have computers, all doctors have computers are there, printers are there. So that is, you'll always find a big IT staff there. Then you again, a lot of payroll, right? So that's a huge payroll, all nurses, doctors, everybody gets paid. There's a HR, there's a lot of hiring that goes on for all these people like nurses and all. Even doctors get hired. They are employees of the hospital, they'll get hired, and all the admin stuff. A huge amount of HR goes on in healthcare. Huge payroll. Finance, of course, it's a huge high ticket item. Every patient is worth tens of thousands of rupees. And if they're hospitalized, 20, 30, 50,000 rupees a day. So it's a high value, lot of monetary transactions happen. They have their own cycles, different billing, making sure insurance is paying them. They are not losing out. So little different aspect, huge finance departments will be there. Materials management is big. Of course, you can see so many things are purchased, right? All the way from food to furniture to specialized equipment to pharmaceuticals. Pharmaceuticals bring their own challenge. They all have expiration dates, right? So a little bit differently it gets handled by the pharmacy department on what they order. You just not order any substitute. So usually there's a reason what they specifically order, how they maintain the stock, so patient care doesn't suffer. So a little bit more complex than the routine materials management. Every hospital will have a training department, training the clinical staff, training all the newcomers, training them on the procedures, training them on the compliance. And within training, I just lumped also the compliance folks who make sure that all compliance is happening. So the hospital doesn't get flagged when any random inspections happen, that, it doesn't get flagged. So admin also a lot of huge opportunities. So one area is what we were doing was we will hire a lot of people from healthcare background. Since I was supporting the clinical staff of US hospitals, we were hiring a lot of people with a master's in healthcare administration. So that is a great area for people who may not be clinical. Okay, so I used to get a lot of doctors who decided that they don't want to practice. Maybe somebody is a physiotherapist or a dentist. They will say maybe for some reason they don't really want to practice the clinical side, but still want to be involved clinically. So they will come and do what is called a master's in healthcare administration, and that opens up opportunities where they can work on the administration side of the hospital, or they can come and support the EHR. So that is the kind of staff, and fairly good starting salaries for these folks that they give, because they're masters, and again it's a specialized degree. So for MHAs, the one very good school we have is IIHMR, Indian Institute of Health and Medical Research. They have 3 branches in Jaipur and Bangalore and Delhi. We used to hire a lot from them. We used to hire from TIS, Tata Institute of Social Sciences. Occasionally I have hired a few people from Symbiosis. There are only a handful of colleges that are good. A lot of new have come up, but some are very good. So IHMR is very good. It's almost like one of the top grade schools. Where we have hired a whole lot of people. I used to hire every year there. Robotics, yes, very true. Robotics is one thing that is a game changer. A lot of work is happening in the robotics area, especially if you go to surgeries, what you're saying, contactless surgery, right? So before, what happened, like, let's say I have to, instead of doing a bypass, the cut in the body will be fairly long. Let's say they will put 4 inches or 6 inches of cut. Okay, but now with technology, you can identify the very specific area, and with laser cutting you can cut maybe just 1/4 of an inch or a 1/2 an inch. Very small incision is being done, and you can take care of that surgery. So 2 things happen. First, it is very accurate. Second, the bleeding is drastically reduced because it's a very small cut now. And because the cut is smaller, the patient also heals very faster. So yes, robotics is going to be huge. Absolutely, it's huge. And this will be the game changer. Robotics will be the game changer where many surgeries, so even you can see that many surgeries like cataract and all, they've all become day surgeries. You just go in a few hours, you are done, you come home and it's, you can't even believe that you had a surgery, right? If you want to reach me, definitely I'll love to talk to you, any of you. Just email me and we can set up a time and we can talk. This field, I'll tell you, it's an amazing field because as I said, like I liked it, but I was one of those guys, who cannot tolerate blood and patients dying and all that stuff. But so on the back end, as an IT person, I could still be in this industry without dealing with one aspect that I could not handle. Okay, there are great people like doctors and nurses who handle all that, right? So you can still be involved. And what was the other question? What technical expertise and knowledge courses you would recommend for MBBS student in today's world? Shilpa, if you're an MBBS student, I can't think of anything better than practicing medicine, I'm telling you, because India has a serious shortage of doctors. Now, if you are one of those MBBS who say, I really don't want to practice medicine, then you can look into the administrative side. You can do MHA, right? What I mentioned, it's a 2-year course, and that can put you squarely in the middle of the industry. You can manage a hospital. That's a career path. So that option is also available for you. And also another area, if you're technically good, when I mean technically, like say from an IT perspective, you're good with applications and all, then one opportunity is you can also get engaged in electronic medical record implementations and all. Because there are many companies that need highly skilled people who understand the medicine side of things, but also understand technology, where they can do the implementation of these things. So that is another area that you can look into. But in a nutshell, I would say stick to MBBS because that is for all the investment you have already done. If you have already done it, I'm assuming if you finished it, great opportunity. Specialize. The only other point I would say is don't be a general physician, specialize, because that's where more career satisfaction is there and also good compensation can be there, because we all still need to have a decent lifestyle, right? It's not all about sacrifice, but you can do good to mankind and at the same time live a good life. Guys, any other questions? Oh, Isha, you can check out MHA, which is Masters in Healthcare Administration is one. You can also look at, if you're MSc, you need a science background, especially if you want to look at lab technicians or becoming a radiologist and all. Check that out. It may, because of your science background, you may probably do fairly well in those areas. So multiple areas are open for you, yeah. Clinical psychology, oh boy, okay. See, there's a lot of opportunities for therapy and counseling in hospitals, right? Ritvik, you should check that area out, because nowadays all this counseling is also becoming very big in hospitals and generally as part of the care. Hold a regular, want to do PhD, not regular, can you say any other field? Neha, my suggestion to anybody who has specialized in some area, build in on your field, because if you have already invested so many years, right? You are saying you have done M.Pharm, so I'm assuming you have done at least 3 or 4 years of B.Pharm, which may be 3 years, 2 years of M.Pharm. So already you have invested 5 years in your area. So if you have done that, regulatory affairs is a great area, I'm telling you. Okay, and India, I personally feel India can use some really good people in this area. You can imagine every time, if you ever invest in the stock market, and you can see every time there's an FDA inspection report, you can see the stock of that pharma company, what happens to it. It's like, because they get cited for certain things. So I personally think this is, but see, again, you have to build an expertise. You can't be a generic. So if you're a generic, then there is not much value. Anybody can be this thing. But if you becoming specialized in that area, you will have a lot of value there. That's my suggestion, I'm an MBA in operations, okay. Actually, what I see is really you should look at NLP life coach is a very different area. Really doesn't have to do much with medicine, right? But if you're already in MBA, you should look at working in a hospital. You can see if you can do MHA very quickly, I don't know how easy it is to bridge, because some courses may be common. Because then you can go to hospital operations is a fairly big area. So many times medical people will come to do that, So will come and take that role because there are clinical people and there's a whole variety of staff that is out there. Okay. Yes, Isha. See, when you're MTech, there are two areas you can look into. MHA could be a good opportunities, but remember I had mentioned you can check this out. One is a very good school because we have hired a lot. I personally hired a lot from this school, and is one of the best schools in India. It's Indian Institute of Healthcare Management and Research (IIHMR). They are based in Jaipur, Bangalore, and Delhi. Then, of course, you can look at Symbiosis for specific healthcare courses. Then you also have Tata Institute of Social Sciences. These are some of the better names I'm talking about. And there are many others that have come up in the last few years because healthcare is growing. Yes, in the healthcare analytics is huge, boss. Now, the only thing that's going to happen in healthcare analytics is India itself is not very huge, but there are many Indian companies that do analytics for outsourced analytics, that they take data from US hospitals and all, or even pharma companies, and they do a lot of analytics there. So definitely that is one area you can look into. Yes, analytics is big area, boss. I'm telling you, not within India, but you can learn. There are very specialized tools available, and analytics is done by pharma companies, interestingly done by hospitals. Okay, so various kinds of analytics is done, and there are many smaller players, and they pay very well from what I understand, because your clients are US clients. Many of them also take projects from Middle East and other countries to do analytics and all. So that can be a very good area. You can just do a research in Google, and you can pursue it from there. Okay. Komal, if you are doing microbiology, labs could be a good opportunity. You can check that out. Generally, I will think with that biology, I believe many of the testing labs require that background. So definitely that can help you. Okay. So with that said, if there are no more questions, I'll take a permission and we can end this webinar. Thank you very much, and I hope you enjoyed it, and we'll connect some other time. Thank you very much.